Hello, everyone. Bonjour à tous. Welcome and thank you for participating in today's media update on COVID-19 in Canada with Canada's Chief Public Health Officer, Dr. Theresa Tam, and Deputy Chief Public Health Officer, Dr. Howard New. Bonjour et bienvenue à la mise à jour médiatique sur la COVID-19 au Canada avec l'administratrice en chef de la santé publique, Dr. Theresa Tam, et le sous-administrateur en chef de la santé publique, Dr. Howard New. Following the remarks, we will open the teleconference line to questions from the media. Suite aux allocutions, nous répondrons aux questions des médias. Procédons maintenant à la séance médiatique. Let's begin today's briefing. Over to you, Dr. Tam.
Merci beaucoup. So bonjour à toutes et à tous.
Hello,
this
everyone.
week is National Volunteer Week in Canada, and we're reminded, especially during these difficult times, of how important it is to support each other, to lend a hand when you can, and to know you're not alone when you need help. To date, over 1,139,000 cases of COVID-19, including over 23,700 deaths, have been reported in Canada. Over the past week, an average of over 8,640 new cases were reported daily. During the same time, the number of people experiencing severe and critical illness continued to rise. On average, over 3,970 people with COVID-19 were being treated in our hospitals each day, including 1,200 people being treated in intensive care units, representing a 24% and a 21% increase, respectively, compared to the prior week. An average of 46 deaths were reported daily over the past week, which is 28% higher than the week prior. There are over 70,300 variant of concern cases reported to date across Canada, with the B.1.1.7 variant accounting for almost 96% of these. To tackle this wave, we need to use all available tools. That means keeping up with individual precautions and public health measures in your area, as well as deploying all safe and effective vaccines in optimal ways. Vaccination is fundamental to ending the pandemic, and we encourage all Canadians to get vaccinated to protect themselves and their communities from illness, hospitalizations, and deaths from COVID-19. This week, we marked the important milestone of over 10 million doses of COVID-19 vaccine having been administered in Canada. We know there is still a way to go, but we continue to gather strength from good news and the focus on the things we're grateful for. The simple note of thanks we recently received from a Canadian reminds us of how far we have come. I received a vaccine this week, and I am amazed that this time last year we were struggling to understand this virus, and now we are vaccinating against it. Canadians across the country have been channeling this kind of positive energy to help others. One example is vaccinehunters.ca. This community group has banded together to supplement COVID-19 vaccination initiatives by aggregating up-to-date information on vaccine availability on their website and social media platforms. They are helping eligible Canadians find vaccination clinics and pharmacies where they can book an appointment. Their website also provides links to other local volunteer organizations, such as Pink Cars, who are helping seniors 70 years or older in the York region with transportation to get to their COVID-19 vaccine appointments. Similarly, vacstat.ca helps Quebecers find the same day or next day COVID-19 vaccine appointments through their website. Another important volunteer effort is dispelling misinformation to support informed and confident decisions on vaccination. Teams of independent scientists, health professionals, and science communicators have come together in collectives such as Science Up First and the Canadian Muslim COVID-19 Task Force to make science more accessible across platforms, cultures, and languages. Though this may not be your turn yet, there are many ways younger adults can pay it forward and help family, friends, and neighbors get vaccinated by working online, over the phone, or in other ways to help others. Working together, we can bring the infection rate down and keep it down until vaccines have rolled out across the Canadian population. This is how we can all build the vaccine bridge that takes us to greater safety and back to the things we have missed so much. Thank you.
Merci. Bonjour à toutes et à
Thank
tous.
you.
Cette semaine est
Hello,
la semaine de
everyone.
l'action bénévole au
This
Canada.
week is
Elle
National
nous
Volunteer
rappelle,
Week in
surtout
Canada,
en ces temps
and we're
difficiles,
reminded,
combien
especially
il
during
est
these difficult
important de
times,
s'entraider,
of
de
how
donner un
important
coup
it
de
is
main
to support
quand
each
nous le
other,
pouvons et de
to
savoir
lend a
que nous
hand
ne
when you
sommes pas
can,
seuls quand nous avons
and to
besoin
know you are
d'aide.
not alone when you need
À ce
help.
jour, plus de 1
To date,
139 000
over
cas de COVID-19, dont
1,139,000
plus de
cases of
23
COVID-19,
700 décès,
including over
ont été recensés au Canada.
23,700 deaths have
Au
been
cours
reported in
de la dernière
Canada.
semaine,
Over the
plus de
past
8
week,
640 nouveaux cas en
an
moyenne
average of
ont été
over
signalés chaque jour.
8,640 new cases were
Au cours
reported
de la même
daily.
période, le nombre de cas
During the
graves
same
et critiques
time,
de la
the number
maladie a
of people
continué
experiencing
d'augmenter.
severe and critical illness
En moyenne,
continued to
plus de 3
rise. On
970
average,
personnes
over
atteintes de la COVID-19
3,970 people with
ont été traitées
COVID-19
dans
were
nos
being
hôpitaux
treated in our
chaque jour, dont
hospitals
1
each day,
200 personnes étaient
including
traitées dans des unités de soins
1,200 people
intensifs,
being treated in
ce qui
intensive care
correspond à
units,
des augmentations de 24%
representing a
et de
24% and a
21%
21%
respectivement par
increase,
rapport à la semaine
respectively,
précédente.
compared to the prior
En
week.
moyenne, 46 décès ont été
An average
recensés
of
chaque jour
46
au cours
deaths
de la
were
dernière
reported
semaine,
daily over the
soit
past week,
28% de plus que la
which is
semaine précédente.
28% higher than the
Nous
week prior.
enregistrons plus de 70
There
300
are
cas
over
de variants préoccupants à
70,300
ce jour au
variant of
Canada.
concern
Le
cases
variant
reported to date across
B117
Canada, with
représentant
the
presque
B117 variant
96%
accounting
des
for
cas.
almost
Pour lutter
96% of these
contre cette
cases.
vague, nous devons
To
utiliser
tackle
tous
this
les
wave,
outils
we
à
need to
notre
use
disposition.
all available
Cela
tools.
signifie d'appliquer les précautions individuelles
That
et les
means
mesures de
keeping up
santé
with
publique dans
individual
sa région,
precautions and
ainsi que
public health measures
d'administrer de
in your
manière
area,
optimale
as
tous les
well as
vaccins
deploying
sûrs
all
et
safe and
efficaces.
effective
La
vaccines in
vaccination est
optimal ways.
fondamentale pour arrêter la pandémie
Vaccination
et
is
nous
fundamental
encourageons
to
tous les
ending the
Canadiens
pandemic,
à se
and we
faire
encourage
vacciner
all
pour se
Canadians to get
protéger et
vaccinated to protect
protéger leur
themselves
communauté
and their
contre la
communities
maladie.
from illness,
Les hospitalisations et les décès
hospitalizations,
dus à la
and deaths
COVID-19.
from
Cette
COVID-19.
semaine, nous avons franchi une étape
This
importante.
week, we marked
Plus de
the
10 millions
important
de doses de
milestone
vaccins
of over 10
contre la
million
COVID-19
doses of
ont été
COVID-19
administrés au
vaccine having been
Canada.
administered in
Nous
Canada.
savons que la bataille n'est pas gagnée
We
et
know
nous
there is still a way to
continuons
go,
à nous réjouir
but
des
we
bonnes
continue
nouvelles
to
et à
gather
nous
strength from good news
concentrer sur les choses pour
and
lesquelles
a
nous sommes
focus on the things we're
reconnaissants.
grateful for.
Ce simple mot de remerciement que nous avons
This
reçu
simple note of
récemment
thanks we
d'un
recently
Canadien
received
nous
from a
rappelle
Canadian
tout ce que
reminds
nous
us how
avons
far we have
accompli.
come.
J'ai reçu le vaccin cette
I
semaine
received the
et je ne peux
vaccine
pas
this
croire
week,
qu'à la même
and
époque
I'm
l'an dernier,
amazed that
nous
this
avions du
time
mal à
last year we
comprendre
were
ce
struggling
virus
to
et
understand this
qu'aujourd'hui,
virus,
nous
and
vaccinons
now
les
we are
gens.
vaccinating against it.
Partout au pays, les Canadiens ont fait
Canadians across
rayonner
the
ce
country
genre
have been
d'énergie
channeling this
positive
kind
pour
of
aider
positive
les
energy to
autres.
help others.
Vaccinehunters.ca
One
en
example
est un
is
exemple. Ce groupe communautaire
vaccinehunters.ca.
s'est formé pour
This
compléter
community
les
group has banded
initiatives
together to supplement
de vaccination
COVID-19
contre la COVID-19
vaccination
en
initiatives
rassemblant de l'information actualisée sur la
by
disponibilité des
aggregating
vaccins sur leur
up-to-date
site web,
information on
les
vaccine
plateformes des
availability
médias
on their
sociaux.
website
Ils
and
aident les
social media
Canadiens admissibles à
platforms.
trouver des
They
cliniques
are
de
helping
vaccination
eligible
et des
Canadians find
pharmacies où ils
vaccination
peuvent
clinics
prendre
and
rendez-vous.
pharmacies where they can
Leur
book an
site web
appointment.
fournit également des liens
Their
vers d'autres
website also provides links to
organisations
other local
bénévoles
volunteer organizations,
telles que Pink Cars, qui aident les
such as
personnes âgées
Pink
de
Cars,
70 ans ou plus
who
de
are
la
helping
région de New York
seniors
à se
70 years
déplacer
or
pour se
older in the
rendre à
York
leur
region
rendez-vous
with
de
transportation
vaccination
to get to their
contre la
COVID-19
COVID-19.
vaccination
De même, le
appointments.
site web vacstat.ca
Similarly,
aide les Québécois à obtenir un rendez-vous le
vacstat.ca
même jour
helps
ou le
Quebecers
lendemain
find
pour se faire
same-day or
vacciner contre la
next-day
COVID-19.
COVID-19
Un
vaccine
autre
appointments
effort
through their
bénévole
website.
important consiste à
Another
dissiper la
important volunteer
mésinformation
effort is
pour que les gens
dispelling
puissent prendre des
misinformation to
décisions
support
éclairées en
informed
toute
and confident
confiance en
decisions
matière
on
de
vaccination.
vaccination. Des équipes de scientifiques indépendants,
Teams of
de
independent
professionnels de la
scientists,
santé et
health
des communicateurs
professionals, and
scientifiques
science
se sont
communicators have
regroupés
come
pour
together in
former des
collectives
collectifs tels que la
such
Science
as
d'abord et le groupe de travail
Science Up First
canado-musulman contre la
and the
COVID-19,
Canadian
afin de
Muslim
rendre la science
COVID-19
plus
Task Force
accessible,
to make science more
quelles que soient
accessible
les plateformes, des
across
cultures et
platforms,
des langues.
cultures, and
Votre tour
languages.
n'est peut-être pas encore arrivé,
Though it
mais
may
sachez
not
que
be
les
your
jeunes
turn
adultes
yet,
peuvent de diverses
there are many
façons
ways
poser une
younger
geste
adults can
concrète
pay
et
it
aider leurs
forward
familles,
and help
leurs amis
family,
et leurs voisins
friends,
à se
and
faire
neighbors
vacciner
get
en
vaccinated
travaillant en
by
ligne,
working
par téléphone
online
ou par d'autres moyens pour aider les autres.
or in other ways
En
to help
travaillant
others.
ensemble, nous pouvons abaisser le
Working
taux d'infection et le
we can
maintenir
bring the
bas
infection rate
jusqu'à
down
que la campagne de
and keep
vaccination
it down
ait
until
été menée dans
vaccines
toute la
have rolled
population
out
canadienne.
across the entire Canadian
C'est ainsi que nous
population.
pourrons tous contribuer à
This is
atteindre
how we can
l'immunité
all
que nous
build the
permettra
vaccines bridge
d'être en sécurité
that
et de
takes us to
profiter à
greater
nouveau des
safety
choses qui nous
and
auront
back to the
tant
things we
manqué.
have missed so
Merci.
much. Thank you.
Thank you, doctors. We will now open the phone line to questions. Please identify yourself and include the media outlet that you are representing. We'll be taking your questions in both official languages, and we ask that you limit yourself to one question and only one follow-up. Comme d'habitude, veuillez vous nommer et nous dire quel média vous représentez. Nous vous demandons de vous limiter à une question et seulement une question de suivi, et vous pouvez poser vos questions dans l'une des deux langues officielles. Donc, commençons la période de questions. Over to you, Mathieu.
Merci, thank you. Please press star 1 at this time to ask a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question, la première question est de Philippe Vincent Foisy de Radio-Canada. La parole est à vous.
The first question is from Radio-Canada. Please go ahead.
Oui, bonjour. J'ai une question en français sur les recommandations de NACI, donc du Comité consultatif canadien sur l'immunisation. Hier, on était censé avoir une conférence de presse sur AstraZeneca. Elle a été annulée. Pourquoi elle a été annulée? Pensez-vous pas que ça ajoute un peu de crainte par rapport à la confiance que les gens ont envers ce vaccin-là? Donc, juste essayer de nous expliquer ce qui s'est passé, pourquoi on a décidé de retarder les recommandations.
Delay the recommendations.
Qu'est-ce que vous pensez du fait qu'on les donne aux 40 ans,
and what do you
aux
think
45
about the
ans
fact that it's now being, the AstraZeneca is now being given to ages 40
merci
and up?
pour la question. C'est Dr. New.
Thank you for the question.
Oui, c'est toujours quelque chose qui est un enjeu actuel. Qu'est-ce qui se passait?
That is a current challenge.
C'est le Comité consultatif national de l'immunisation, le CCNI en français,
NACI,
est en train de
National Advisory Council on Immunization, is receiving and analyzing
qui se sont soumis à jour. C'est toujours un défi parce que si on attend toujours des autres données probantes avec l'expérience à travers le monde, mais aussi au Canada,
being done across the world and here in Canada, then we're criticized for being too slow. But
peut-être trop vite,
if we make a decision too precipitously and then the next day some further data surfaces, we may be criticized for acting too quickly. So I understand that they are currently analyzing very important data.
Qu'est-ce qui est disponible au Canada? Je pense concernant
including the data that's available here in Canada and weighing the benefits and risks.
Ça va donner des autres considérations peut-être pour ajuster leurs recommandations.
Mais so they may be considering adjusting their recommendations further. But in the end,
est toujours sensibilisé à faire cette donner des recommandations avec leur expertise pour les provinces et territoires à considérer pour leur propre programme de vaccination. Parce que c'est en fin de compte, c'est vraiment les provinces et territoires qui sont responsables. Et je pense que les changements mettent quand même les quelques provinces a déjà fait des modifications, des changements. C'est aussi parce que on a eu une réunion, même une téléconférence la fin de semaine précédente avec le comité et on a discuté aussi les dernières données probantes disponibles. Donc, les provinces et territoires ont déjà commencé à adapter leur programme de vaccination. Et maintenant, le comité est en train d'analyser d'autres.
And now the committee continues to analyze even more recent data. So I believe that soon they will be making another statement with possibly another update, more updated recommendations. I believe that people should feel confident, and I think that this will help bolster the entire Canadian population's confidence in this vaccine. We can see how seriously the committee takes its work and is constantly analyzing updated data and evidence and adjusting its recommendations as the science evolves. Thank you.
Theresa Tam, could I...
Can you just repeat that in English, please? Yes, go ahead, Dr. Tam.
Yes, I was going to just repeat that in English because I think everybody seems to have an interest on this question, which is about the National Advisory Committee on Immunization and why they didn't do their technical briefing yesterday. So as Dr. New had indicated, the committee, the National Advisory Committee on Immunization, was about to release their latest recommendations, an update to the recommendations for the use of AstraZeneca vaccine in light of the rare reports of a serious blood clotting and low platelets disorder. And just to reassure everyone that it is because they received some new data that they thought was pertinent in terms of analyzing the impact of the COVID-19 on the population in light of variants of concern, and not because of any changes in the data already existing for the thrombosis disorder itself. That remains a rare disorder, and the rates that they were looking at hasn't changed. It's more when you're balancing the benefit and risk analysis, it's important to look at the benefit of the vaccinating individuals, given the increase in the epidemic activity in many parts of the country. And so that is what they're working on, just to validate the information that they had before with the new data. But as Dr. New said, the data is always undergoing evolution. So they're going to take this final look, and then they'll be out with the update shortly. We did have a meeting with all the chief medical officers and the National Advisory Committee on Immunization over the weekend. So they do have the analysis at hand as they were making their decisions that you have seen announced over the last few days.
Thank you, Dr. PV. Question suivie?
Oui, do you have a follow-up question?
On voit qu'il y a des vols en provenance du Brésil encore qui sont acceptés au Canada.
On voit qu'il y a des vols en provenance d'Inde being accepted in Canada, as well as from India. À quel point la santé publique se préoccupe de voir qu'il y a des gens qui peuvent encore rentrer au
Health
pays
Canada be
avec
concerned
des
by the fact that
variants
people can continue to enter the country carrying variants from countries in which the situation is not at all under control? How far, how much is this of concern? It seems too that the follow-up measures are not properly implemented. So how is Health Canada concerned by the fact that we're still seeing flights coming in from countries in which variants of concern come? Answer. This is Dr. New. Perhaps I can begin to answer. Well, it's always a concern that we keep an eye on. We're keeping an eye on what's going on across the whole world and deciding what we do about our borders. Because protecting Canadians' health is always our priority. I think that with the measures currently in place at our borders, we are currently requiring that any visitor arriving in Canada undergo a test before they arrive in Canada and then take another test once they arrive in Canada, and another one 10 days later to ensure that they are not infected. And of course, there is the 14-day mandatory quarantine period. So I think with all of those measures taken together, they are amongst the most rigorous measures and requirements in the world. But of course, we're always watching what's going on with the emergence of these new variants. You mentioned Brazil and India, and there may be other countries further down the road. I think it's always important to maintain a global approach. And once new variants are identified, of course, it's like chasing your own tail. The virus continues to mutate, but we're always open to looking at the measures taken at our borders, and we continue to analyze and collect data and evidence from here and from other countries. But I think it's important to understand that it's not just about the variants at our own borders and what's going on in other countries, because we know that with viruses it's practically impossible to prevent new variants from arriving here in Canada. look what's going on
le variant identifié au
with the
Royaume-Uni.
variant identified in the United Kingdom. It's very important to figure out what it is we're doing inside our country.
L'émergence des variants, c'est très important
Once these new variants have emerged here,
it's
very important to do contact tracing and lots of testing. There are many things that we must continue to do here in Canada.
Dans le pays, à part de seulement regarder et viser sur qu'est-ce qu'on fait
just focusing on what's going on at the border.
Merci.
Thank you.
Merci, Dr. New. We'll take
Thank
the
you,
next
Dr.
question.
New.
So maybe, sorry, it's Theresa Tam. I'll just repeat that in English because I think there'll be another question, there'll be a similar question coming up about the border measures and what we're detecting and what might be some of the concerns. So, of course, the virus globally is undergoing evolution, and there are many different mutations and changes in the virus, particularly in countries that have a lot of cases. Of course, that gives the virus more chance to do that mutation. There's been several that's been identified as variants of concerns that you've all heard about, the B117, B1351, and the P1, which was originating from Brazil. So given that situation, the strategy for Canada was to add more layers of protection for every country. So the pre-boarding test, the post-arrival 2 tests, and of course our foundation, which is the 14-day quarantine, trying to add more reinforcements. The government authorized accommodation to await that first test, and just engaging more people on the ground, ensure compliance. Were all put together at the time when the UK first notified of a variant of concern. There are many variants which are under monitoring, which we call variants of interest, which includes the variant that has been reported from India. We don't understand enough about it, but there are mutations on it similar to other variants of concern, which means that, of course, we need to look at that data very carefully, but there's not a lot of information that's coming out of India at the moment. But so these are universal measures that we've been layering upon at the border. The testing has been very helpful. So we've been detecting test positive travelers, as well as sequencing every one of them to look at what variants might be coming across the border, and that will help inform us of what further needs to be done. For Brazil, there are low numbers of travelers. The P1 variant has been picked up through border screening, but not just from Brazil though, because we know that it's actually in 50 probably now, somewhere between 40 and 50 other countries. So country-specific targeted measures can only go so far. It's actually the broader application of measures to all countries that Canada has been focused on. India, we will be doing further analysis because it's an emerging situation, not just because of the variant of interest at this point, but because they have unfortunately, a very massive resurgence in that country, and we'll be doing that risk assessment again and using the data that we have now collected at the border to inform our next steps. Thank you.
Thank you, doctors. Now we'll go to the next question. Operator.
Merci. The next question is from Annie Bergeron-Oliver of CTV National News. Please go ahead.
Hi, thank you for taking my question. Nearly 1 million people in Canada now have nearly 1 million Canadians have now been fully vaccinated, and many of those are high-risk seniors living in congregate care. The CDC eased public health restrictions for fully vaccinated people weeks ago. Why hasn't Canada changed the rules, especially when it comes to seniors who are essentially still locked up in their long-term care homes?
So yes, we've had 10 million close to 10,500,000 individuals vaccinated at least with the first dose. And we do know that some of the long-term care facility residents are now receiving their second dose. So that's great news. The other great news, of course, is seeing in the seniors coming down and the number of long-term care facility outbreaks coming down. And even the ones having outbreaks, there are fewer cases. So that vaccine effectiveness is being monitored in key jurisdictions with researchers and demonstrating the effectiveness of that initial dose, but coming back with that second dose. So I think that's important. And to change policy, I do think that the long-term care facilities are the one area where you will see that policy shift beginning, so that there will be more ability for seniors in those homes to return back to some of the normalities and having more visitors, although the visitors, of course, may not be vaccinated at this point in time. But all of the precautions still has to be taken. But provinces are in charge of those policies, and you will begin to see them using the data at hand and what they're seeing on the ground in order to adjust those policies. But of course, outside the doors of the long-term care facilities, we have a ways to go. Some of the senior age groups haven't completed the vaccination, although those seem to be going well. And healthcare workers, we want to make sure they're all provided with a vaccine. I think the uptake's quite really good too in healthcare workers, close to 90% with at least one dose. But just a reminder that, of course, Canada's strategy is getting one dose to everyone as fast as possible on all the eligible age groups and coming back with that second dose. We are taking a community-based approach where individuals are protecting themselves with that very effective first dose, but also to generate the community level of I protect you, you protect me kind of concept in direct protection, so that everyone can benefit from increased social and connections as a result of that community-based, population health-based approach. But I do think that, of course, we'll all begin to adjust those measures. But if you look at the United Kingdom being the country closest to us with their strategy of the one dose with stretch interval, they are being very careful. You need to drive down that epidemic. So this third wave needs to come under control, and then we need to be able to ease those measures very slowly while the vaccine coverage is increasing.
Okay, well, that leads into my next question. My follow-up is that a chart in the budget suggests about 80% of Canadians will have at least one dose by Canada Day, with the economy projected to pick up drastically starting very shortly after. Will a strong majority of Canadians only getting one shot be enough to ease restrictions across the country?
So what eases restrictions across the country is getting the epidemic under control, the pandemic in Canada under control. That has always been the driver of easing measures. Do not ease measures rapidly on the way down. Like this is what happened in that second wave. You ease, partially down the epidemic curve, the virus will come back very quickly. With vaccines on board, the chances of that may be diminished, but it's not, completely eliminated. And so getting that second dose is very important to ensure that when we relax measures, you're not back to sort of the beginning of trying to get the virus under control. It has to be both public health measures and the vaccine right now to plank the curve again. That's what's going to let us have more relaxation in those restrictive public health measures. So, of course, we want to track this as we go along, but vaccines gives us a much better chance of being able to do that. So that's why it's very important to get vaccinated.
Yeah, it's Dr. You just said to underline what Dr. Tam said. I think we've said it several times, myself included, that we should be following the data and not just dates. So vaccination, certainly vaccines are a very important tool, very key in terms of, as you say, trying to get towards a sort of a future where we might be relaxing some restrictions, but certainly the public health measures are key. Certainly, look what's happening now in Ontario. It's not going to be vaccines alone that solve the current situation in Ontario. You need to be very strict with the public health measures, and I would say that's also twofold. I think at an individual level, people really have to think about what activities they're undertaking. Are they really just the essential activities, going out for groceries and so on? Or, are there still some discretionary activities that they really should not be doing, like, traveling for a vacation or going for a recreational sort of a pleasure activities, even outside of their own community. So that's something to consider. And then, of course, at the population level with governments and so on, it's a type of restrictions that really try to decrease mobility and decrease the types of interactions, the number of interactions people have. And I think to support, what was put forward by the Science Advisory Table in Ontario, it's not just a matter of saying people, decrease your contacts. There are many people, the essential workers, that are not able to, for lots of reasons we all know about, in terms of, lack of sick days, other social supports, and so on. So I think to get to that point, it's very important to have those supports as well, so that all Canadians can hopefully, in a sense, feel protected and have the measures in place that they can also practice personally, and also at a population level of the public health measures as we keep rolling out the vaccines. Thank you.
Thank you, doctors. We will move to the next question. Prochaine question, opérateur.
Merci. La prochaine question est de Raymond Filion de
Next
TVA.
Question,
La parole est à vous.
TVA. Please go ahead.
Merci beaucoup. Dr.
Thank
Liu, juste
you.
pour revenir
Dr.
à l'Inde
Liu,
et
just
ses
to come
variants,
back
est-ce que suspendre
to
les
India and
vols,
its
comme ça a été le
variants.
cas cet hiver pour le Royaume-Uni,
If we
pourquoi c'est pas un
suspend
scénario qui est
flights,
envisagé à l'heure actuelle?
why
Vous pouvez
aren't we
juste
considering
expliquer
suspending
ça
flights from
brièvement.
India as we did in the spring or last year
Okay,
for
brièvement, je
United
pense
Kingdom
que,
when its
je
variants
pense même le
emerged?
Premier ministre a
Just
constaté,
briefly, even the Prime
en
Minister
examen, il y a toujours toutes les
has
options
stated
sur
that
la table.
all
Donc, je
options
pense
remain on the table.
qu'il faut
I
faire une
think
analyse, parce
that
qu'on
we do
a
have to
maintenant
perform
aussi,
a proper analysis.
l'expérience avec qu'est-ce qui se passait
We
avec,
now
comme vous
have
avez constaté,
experience
l'expérience avec le
with
Royaume-Uni.
what happened with the
Après
UK
ça, on a mis
variants, as you
des autres
said.
mesures
So
en
after
vigueur
that,
à nos
we
frontières avec le
implemented further
dépistage
measures
avant
at
l'arrivée
the
des
border
voyageurs
with
ici au Canada,
pre-testing,
puis aussi des
pre-arrival
dépistages,
testing,
aussi la
and
quarantaine
arrival testing,
de
as well
14
as
jours
the
obligatoire.
14-day
Donc, il
mandatory
faut
quarantine
examiner les
period.
mesures
So
qui
we
sont
have to
déjà
look at
en
measures
place
that are
maintenant.
already in place
C'est quoi
today,
l'efficacité des
see
mesures?
how
Est-ce qu'on
effective
peut faire
those
des
measures
autres
are,
ajustements?
see if they need to be
Comme
adjusted.
Dr. Tam et moi,
And
on
as
aussi,
Dr.
on a
Tam
constaté,
and I have
c'est difficile
stated,
toujours comment dire, de viser un pays à la fois. Je pense que c'est peut-être plus important, plus efficace, peut-être
it may
avoir
be
une
more
approche comme dit
effective
globale
to
pour
adopt a
assurer la
global
sécurité à nos
approach rather than focusing on one
frontières,
country at a
comme si
time
c'est possible. Mais oui, aussi au
ensuring
fur et à
safe
mesure,
borders.
s'il y a quelque chose, on peut faire
But if there are
comme
other
dire,
measures, we
rapidement pour
can
gérer une
implement
situation,
quickly
par
to
exemple,
manage
pour
a
l'Inde. Je pense
situation. For
qu'on est
example, the
toujours ouvert
situation
et
in India.
on est en
We're
train
always
d'avoir des
open to that
discussions et aussi
possibility,
une
and our
évaluation, une
conversations,
analyse
our
des
discussions
risques à
continue,
l'heure
as
actuelle.
do our analyses of current risks.
En suivi, à quel point,
As a
selon
follow-up
vous,
question,
c'est impératif à
in
l'heure
your
actuelle de
opinion,
réduire ou d'éviter
how
complètement
important
les
is
déplacements
to
entre une région à l'autre du Canada, entre les provinces, surtout avec les
prohibit
variants?
movements between various regions in Canada or provinces,
Oui, je pense
especially given
que
the new
c'est un
variants?
enjeu actuel.
Well, I
Je
think
pense
that is a
avec
current
toutes les
issue,
provinces et territoires, je pense même en
along with
Colombie-Britannique,
provinces and territories, even in British
on
Columbia,
a
I
déjà
believe.
conseillé, encouragé, je ne sais pas c'est quoi,
We have
tout le
advised
vocabulaire
or
des mots des
encouraged
Canadiens de pas
Canadians,
se
or they have
déplacer, vraiment
encouraged
rester chez
Canadians
vous,
to stay at home,
rester dans votre région. Peut-être,
to
oui, c'est
remain in
toujours
their own
important
region.
peut-être sortir, prendre l'air fraîche,
Of course, it's always
mais
important to go
sûrement dans
outside and
votre
get some fresh
communauté, pas
air,
vraiment
but
se déplacer, même
to really to stay in your own
dans
community,
votre
not even to
région. Je
move
pense
around
que,
inside your
par
region.
exemple, en
For example,
Colombie-Britannique, si
in
on
British
est à
Columbia,
Vancouver,
if you're in Vancouver,
on décourage les gens de même aller à
residents
Whistler,
of
même si
Vancouver
c'est
are
dans la
being
même
discouraged to
région,
go
on
to
peut dire,
Whistler, even though
de la
one could say
Colombie-Britannique.
that
Je
it's
pense
in
que
the
c'est le
same
même
region
principe
or the
partout
same area, and I
dans les
think the
pays
same
et
principle
aussi
applies across the
on
country.
décourage les gens de
People
se
are
déplacer
being
entre les
discouraged
provinces.
from
traveling between provinces.
Même on a vu beaucoup de Canadiens
As we saw,
sont
many
allés
Canadians
peut-être dans les autres provinces pour les
traveled to
loisirs,
other
des vacances de
provinces
ski. Et maintenant,
to go
c'est
ski
avec
and
les variants,
have other
c'est
types of
vraiment
holidays. And now we're saying, look, with these new
On voit
variants,
ce qui se
it's
passe
really
actuellement
important. We can
en
see what's
Ontario.
going
C'est
on
une
now in
crise.
Ontario.
Une
It's
crise
a
de
real
santé
crisis.
publique, une
It's
crise
a
avec
public
le
health
système de soins
crisis
de santé. Je
and
pense
a healthcare
qu'il faut
crisis.
vraiment comment dire, tirer des leçons avec
We
qu'est-ce qui se
really
passe
need to learn
actuellement en
from what's
Ontario.
happened and
Et
what's
c'est
going on
vraiment
right
pour
now
tout
in
le monde,
Ontario.
restez chez vous. C'est simple.
People just need to stay at home. It's quite simple.
Merci, Dr. New.
Thank you, Dr.
Next
New.
question.
Thank you, merci. The next question is from Evan Dyer of CBC News. Your line is open. Please go ahead.
Hello, thanks for taking my question. I'd like to ask, you mentioned that you're currently doing a risk analysis on the situation in India. Do you know when that might be ready?
I can't comment on that. We are always looking at the data, including who is testing positive coming into Canada, for example, and we have to get as much information as possible, for example, on that variant of interest, and which is not yet a variant of concern. So lots of work is being done in multiple departments to look at that situation. But as I said, that it can be one country one day, another day. So it is very important that we have been taking these more broad measures for any traveler.
And just to follow up on that, I know that India and Brazil both have variants, but are very different countries in a way. I mean, India's been a kind of a model citizen, sharing vaccines with other countries. Brazil, I think, has been widely seen as a very irresponsible government, not taking COVID seriously. You were talking about the idea of, I protect you, you protect me, and we do penalize individuals who don't take COVID seriously in Canada. Do you think that as this pandemic develops and as we start to emerge from it, there will be a place for pressure or action against countries that don't appear to be taking COVID seriously, continue to spin off variants that threaten other countries' vaccination campaigns?
Well, I think, internationally, in many ways, we are in it together. And as long as countries are not able to control what's happening domestically, it will affect everyone else. But we have to control what we can control, which is the measures that we've sort of put in place. The many layers, we kind of kept adding some more. But the testing regime, I think, is really important so that we can manage the individuals coming into Canada and reduce the risk of the variants of concern. I mean, I think if you look back at the statistics, the number of travelers have already been significantly reduced compared to, of course, pre-pandemic times. But these layers of measures are meant to help us reduce that spread. No border measures are completely 100% effective, of course. Every layer adds another layer of protection. I do think that it is important, wherever we can, to assist others so that it has a benefit at the other end for Canadians and people who are in this country as well. So I think it takes so many layers of discourse and arrangements, some of which is not really in the agency's area of influence. But I think the whole of government and our ministers are, of course, looking at that in terms of other countries. Anyways, I think maybe I'll leave it at that. Thank you. But Brazil and India are actually very different on many other fronts. There are many more connections with India to Canada than there is to Brazil for all sorts of reasons, and many different types of travelers and many Canadians who in India, and there's traffic from that perspective as well. So there's many considerations before any other actions taken.
Thank you. Operator, next question. Prochaine question.
Merci. La prochaine question est de Boris Proulx
du Devoir.
Next
Votre ligne
question
est
from
ouverte.
Le Devoir. Please go ahead.
Bonjour, j'aimerais rebondir sur la question plutôt concernant le Comité national sur l'immunisation. J'aimerais savoir si vous pouvez me résumer quels sont ces travaux en ce moment, parce que on veut savoir ce qui se passe. On comprend que 10 minutes avant la conférence de presse hier, ils l'ont annulé parce qu'ils ont reçu de nouvelles informations. Juste au moment où les provinces abaissent l'âge du AstraZeneca à 40 ans. Donc, pouvez-vous me dire exactement qu'est-ce qu'on étudie de ce côté?
To 40. Can you tell us anything more about that?
Dr. New, peut-être moi je peux
This
commencer.
Is Dr. New.
Oui,
Perhaps I can begin
si
to
je
answer.
peux peut-être préciser qu'est-ce qui se passait pendant la semaine.
I can tell you
on
what's
a eu
going
une
on this week.
téléconférence avec le Comité consultatif national d'immunisation, CCNI, avec aussi le Comité consultatif spécial, tous les médecins hygiénistes des provinces et territoires. Et je pense que c'est basé sur la discussion et les données probantes, la présentation de CCNI, je pense à la fin de semaine précédente, que les provinces et territoires ont annoncé les modifications, les ajustements dans leur propre programme de vaccination pendant la semaine. Et maintenant, le CCNI est en train de recevoir d'autres données probantes. Je pense que c'est pas changé. Ce que je comprends, c'est vraiment sûrement pour être plus à jour avec, je pense peut-être, les avantages, regarder vraiment l'échelle de la population, en considération aussi avec l'épidémiologie régionale, tout ça. Il y a beaucoup de facteurs, mais je pense bientôt, on attend impatiemment la présentation, déclaration,
we all impatiently await any further statements, updates, or presentations by the Advisory Council following their analysis of new evidence and data. I don't think that the provinces and territories' recommendations will change, however, because they've already received the important analysis of the data by NACI and adjusted their eligibility guidelines.
Efficace.
Look, this is an effective and safe vaccine.
Homologué par Santé Canada.
It has been approved by Health Canada. And it's very important during this third wave in many provinces to use all available tools as quickly as possible and vaccinate as many Canadians as quickly as possible. So I think the fact that provinces,
vous savez, ont déjà, ajusté,
have already adjusted
le groupement d'âge pour être éligible pour le vaccin AstraZeneca.
For AstraZeneca
c'est vraiment quelque chose d'important.
Is a very important
on va continuer à suivre la science et peut-être ajuster au fur et à mesure comme c'est nécessaire.
Evidence and trust the science and adjust measures as required.
Follow-up question.
Yes, I think earlier this week you answered a question about women that seem more affected by these rare cases of blood clots. I'd like to know if,
du cumul des données probantes, il est possible ou vous considérez prioriser certains types de vaccins en fonction du sexe. Donc certains types de vaccins pour les hommes, par exemple,
recommending one vaccine over another for by gender.
Okay, c'est Dr. New.
One for men, one for women in some cases.
This
is Dr. New again.
C'est un événement très rare.
Look, I want to clarify that this is an extremely rare event.
Physiologie,
even the physiology
ça arrive avec
as to how
cet événement très rare avec les
extremely rare event, such as blood clots.
C'est différent peut-être si on a déjà
Maybe
comparé avec les autres risques pour les femmes avec la contraception. Je pense qu'il n'y a pas assez de données pour vraiment,
for example.
Tirer les conclusions qu'il y a vraiment une différence. Les premiers cas qui ont été signalés, je pense en effet c'est peut-être une biais parce que si on a commencé avec la vaccination des travailleuses de soins de santé du vie parce que c'est un groupe prioritaire. On sait que parmi ce groupe de priorité, il y a beaucoup de femmes parce qu'ils sont des infirmières, tout ça. Donc, ça c'est quelque chose aussi souligner
that
comme
has to be
point.
taken
Donc,
into account as
jusqu'à
well.
date, avec toutes les
So
les
far,
analyses des données probantes,
given
on n'a
all the
pas trouvé
data and
qu'il y
evidence
a vraiment une différence.
received, we have
On
not
peut dire
found
que
that there
c'est
is
vraiment
a real
les femmes
difference.
sont plus à risque que les hommes. Donc, je
And we
pense
really
que
cannot say that women
pourquoi
are at
le
greater
Santé
risk than
Canada
men, which is why
aussi
Health
tous les autres
Canada, as
régulateurs
well as all the
à
other
travers le monde
regulatory bodies across
ont
the
pas recommandé
world,
pour
did not
tous
recommend
les pour les femmes et aussi pour les hommes. C'est pas
that this
comme
vaccine only be given to men.
plus comment dire un risque augmenté pour les femmes.
It's not really an increased risk for women.
Theresa Tam, I'll just clarify that point as well in English, that there is no specific risk factors for the thrombosis, thromboembolic syndrome with low platelets. It's a very specific underlying mechanism that is driving that rare event. There is no sex or age risk factors for that condition. How provinces in deciding the program and the National Advisory Committee on Immunization comes with a recommendation according to age groups is actually based on the impact of COVID on different age groups, where you get a much more severe outcomes and in the older age groups. It's not because there's an underlying risk factor that is currently evident on the thrombotic event.
Merci beaucoup. Upper, next question. Prochaine question.
Thank you. The next question is from Mia Rapson of the Canadian Press. Your line is open. Please go ahead.
Yeah, I'm just wondering, Dr. Tam, if you could give us some more information about exactly what data was provided to NACI, what study. You said it wasn't about the blood clots, but more about the variants. I'm just wondering if you could tell Canadians what specifically they were given new data on that sort of pushed this back, not just a little bit, but by several days. And also, how relevant has NACI made itself in a pandemic when maybe the model isn't set up to make decisions as quickly as we need them? Do you think that this model is actually working in a pandemic?
Well, science is always evolving and is evolving fast. So it is quite challenging. And I can guarantee that everyone from the regulator to NACI to our epidemiologists are working continuously. So you're right in that you can't just keep shifting recommendations all the time. You do have to have analysis that you can settle on for now. Obviously, if there's any significant changes, the committee will go back and have another look. So I don't have all the details. All I was told is actually about the impact of COVID-19, including the emerging variants of concerns, impact on severe outcomes. So that data has to come from the provinces and territories. And as they provided some new information, particularly and on that front, I think that's what they're looking at. And it may not change anything in terms of what they've already come down to. I'm not sure. That is still in progress. And maybe I can leave it at that. But it is challenging for everyone in terms of the policy space for public health. But we want to, I think uppermost in everybody's minds right now is that we wanted to provide the best advice because it's about safety. And therefore, Canadians need to be reassured that all of these checks and balances are in place so that they can make those decisions to get themselves vaccinated.
Thank you. And Dr. New, I understand that there was a meeting of the chief medical officers yesterday afternoon. The last time you met, or at least just discussed the AstraZeneca issue, it was decided that every province would follow the recommendation not to give it to people under 55. Now we have seen provinces sort of jump out and make different decisions. How hard is it for Canadians to understand what is happening or what they should do when the provinces aren't aligned, we don't have information from NACI, and how hard do you think this is going to be in terms of vaccine hesitancy?
Well, thank you very much. Multiple questions there. First of all, I would say that, it's never a question of everyone, quote, being in lockstep. As NACI has indicated, and I think I've sort of said as well, is that their recommendations that they put forward takes into account sort of a broader public health perspective compared to the regulator, which looks at a product on a one-by-one basis, looking at the overall sort of benefits versus the risk. So with respect to NACI, that broader public health perspective takes into account epidemiology, looking at other vaccines available, and so on and so forth. So taking that now a step further, as you mentioned, with the provinces and territories, at a certain point in time, based on their understanding, their knowledge of the epidemiology and their context, what they're doing with their vaccine programs, they more or less, I think, had a similar thinking and approach with respect to, I think you mentioned the pause for those individuals under age 55. Now what's happened, as we've alluded to several times, there was another meeting teleconference that was held on the weekend. And as the province and territories looked at, sort of within their own jurisdictions, looked at their epidemiology, looked at the factors at play, they obviously, as always, the same principle, adjusted their programs to make sort of the best sort of a sense on their context. And therefore, you are seeing maybe a variation. Certainly, I think the 6 provinces Atlantic, to varying degrees, their epidemiology, I think, in terms of case counts, serious illness, hospitalization, deaths, is different compared to, let's say, the territories up north in the Atlantic region as well. And therefore, that's why you're seeing, I think, adjustments made sort of to get out the vaccines in the best possible way based on the epidemiology. So I think, for example, Quebec, I understand they have a different age cutoff, but I certainly respect the fact that based on their epidemiology, based on their analysis of the factors, this is what makes sense for sort of the Quebec context. And then you can see in Ontario, they made other adjustments where there's also, besides sort of the age, I think it's 40 plus that's eligible for AstraZeneca, they're also looking at targeting, I think, maybe putting vaccines or having vaccines available for administration in so-called hot zones and so on. So you can see that the provinces and territories are doing what they believe based on the evidence and the science is really sort of best serving for their context. And I think Canadians hopefully can understand and get that it's hard to have a one-size-fits-all approach. NACI puts out a broad recommendation, but I think it's more of I would call it a framework. It gives us certain parameters and certain factors to consider that obviously the provinces and territories then take to heart and then apply obviously their own lens and their own context before adjusting their programs as necessary and appropriate for their local situation. Thanks.
Thank you, Doctor. Operator, next question. Prochaine question.
Merci. The next question is from Tonda McCharles of the Toronto Star. Please go ahead.
Hi, thanks. I'll be honest, I don't really understand the explanation and the tie-in if NACI was getting information on the severe impact of COVID and variants, what that necessarily has to do with their expected recommendation as to the risk of thrombosis with the vaccines, and I understood that they were going to be weighing in on that. So maybe, perhaps you can take another run at clarifying exactly why they couldn't give the recommendation clearly on the risk of the the risk of the thrombotic events associated with the vaccines. And my question around that has to do with apparently there's been an analysis that all of the vaccines, both the mRNA vaccines and the viral vector vaccines, all carry this very rare risk. So I'm wondering if Health Canada is thinking of putting a warning similar to the one that you initially put out on AstraZeneca for all the vaccines.
So sorry, I might have missed the last bit. Just to really clarify, you brought up a very, very good point, which is the risk of the thrombotic event doesn't change. So that is not, it has not changed. It has not changed in the analysis. It is a rare event that occurs 1 in 250,000 to 1 in 100,000, I think is what broadly everyone has been using. Of course, the data could evolve, but that hasn't changed. What changes is what is happening with COVID-19 in your area. That balances the risk and benefits, because the vaccine is going to be a very effective tool in reducing severe illness and deaths for sure. And so the benefits of the vaccine absolutely will outweigh the risk of the clotting disorder, particularly in areas of high transmission and high impact. So I'm not sure if that's clear enough, Tonda. Do you want me to?
That helps. Yes, thanks.
In your risk,
thank you.
In your risk benefit analysis, yeah. So could you repeat your last part? Sorry about that.
Yeah. So given that there's some suggestion that all the vaccines, all 4, carry this rare risk, have we changed the warnings on all of them?
So I think that there's thrombotic phenomenon that may be different, that needs to still be unpacked scientifically. But one other vaccine of interest to Canadians where changes is sort of expected is the Jensen vaccine. Jensen is a viral vector vaccine, very similar to that of AstraZeneca. So that also is a vaccine that Canada expects to be deploying. So Health Canada is aware of the EMA announced label updates that reflect reports of the blood clots with low platelets related to the J&J Jensen vaccine. So they're already reviewing that information and looking at that in our Canadian context. Similar process as they did with the AstraZeneca vaccine, and they'll be working with manufacturers, FDA, EMA, and other international regulators. So then they will take the action if necessary before that vaccine is made available to Canadians. That vaccine hasn't rolled out as yet. And the regulators at this time around the world have determined that for that vaccine, overall, the benefits outweigh the risks. NACI will make recommendations on the Jensen vaccine, and it will take that information into account because that statement hasn't been drafted or finalized yet. So that's good because now they can take into account any new information on the blood clots or low platelets associated with that vaccine. And of course, we will be reviewing any information pertaining to any vaccines, but the Jensen vaccine is of the most interest at this point.
Thanks. And can I just ask quickly? There's a number of doctors who feel that either Canada has already approved, I think at least one monoclonal antibody treatment, and yet there are others that are on the regulatory pipeline. And there are a number who feel that would be really effective right now, especially in places where the hospital systems are really under pressure, and it could take some of the people who are ending up in hospital out of the hospital scene and free up a little bit of capacity. Can you talk to us about that? What is your sense of whether these monoclonal antibody treatments either are available to them and not being used, and if they're not being used, why not?
Yes, I will try and answer that question, and maybe you can follow up with our media relations to get any more details because the treatment side is something that maybe you need to get more information from others and perhaps from the regulator. So we do know that there are these monoclonal antibody treatments available and other treatments as well. So you've provided a very important question, which is that, of course, we've been talking about vaccines, we've been talking about testing, diagnostics. Well, treatment is another area that there's been a lot of work in, and people are pursuing different kinds of treatments. But the most important one, actually, I really feel that changed a lot of the clinical practice is dexamethasone, the steroid that is commonly available to treat patients, was found to actually have a significant benefit, and it's become part of the routine management of patients in the ICU and in hospitals based on clinical judgment, basically. So what is available, I do know, is that tocilizumab is one medication, and it helps like these antibodies to reduce inflammation, some of the significant inflammatory responses as well. And so medication has been purchased and made available to provinces and territories. And not all of them are using this medication to the same extent. And so, as I understand it, some of that supply has been shifted to Ontario from a reallocation from other provinces and territories. So that is an example of how that is happening right now.
Thank you, Dr. Tam. We have time for one last question. Dernière question, opérateur.
Merci, thank you. And our last question is from Crystal Og of Global News. Please go ahead.
Hi, Dr. Tam. Thank you for taking my question. We're specifically looking at Ontario here. The ICU numbers are raising and hospitals have transferred hundreds of patients. Is this something that comes up on your calls with provincial counterparts? And are these conversations about transferring as far away as other provincial ICUs?
It's a subject of intense conversation, I think, both at a political decision-maker level and at the operational level. So with the operations center at the Public Health Agency, as well as public safety and many federal departments, in terms of what offer of support we can provide to Ontario. That is on the healthcare side, so I'm less involved in that. But I know that we're looking at supplies from the NES, for the National Emergency Strategic Stockpile, that helps ICU patients, whether they be ECMO machines, oxygen concentrators, oxygen supply equipment, and any of the other kinds of equipment they need. But having said that, mobile health units and other measures. What has been requested, I believe, also support for health workers. So it's not the equipment that is necessarily the rate limiting step. It's that you need teams of people experienced to operate these different types of equipment needed to support someone who's very sick. So I know that discussion is extremely live, and we do have underlying protocols and policies that support mutual aid between provinces and territories. And absolutely that is a very live part of the discussion with Ontario right now.
Thank you. And as a follow-up, the European Union has turned down 300 million doses of AstraZeneca and Johnson & Johnson. What's your reaction to that decision? And does Canada intend to try and scoop up those doses for ourselves?
I missed the very beginning of your question. Who was giving up?
Oh, sorry. The European Union has turned down about 300 million doses of AstraZeneca and Johnson & Johnson. So my question to you is, what's your reaction to that decision? And does Canada intend to try and scoop up those doses?
So I haven't heard of that. Thank you for that piece of information. I'm not intimately linked to the supply, but all I do know is that every stop is being paused. Ms. Annan would have spoken about this, and I know she's on the phone and other teams on the phone with European countries, any countries that may have supply. So I'm sure that that is very much part of their strategy, but I don't have any details. Thank you.
Thank you, Dr. Tam. That will conclude today's media update. C'est ce qui met fin à la conférence de presse pour aujourd'hui. Bonne journée.